All right, as it is now 10:01, I'm going to get us started, but we might have a few more people showing up as we get going, so we'll allow for more questions at the end if you miss any content as you're entering. Thank you so much for joining us as we gather today on Earth Day, a day born in Wisconsin that serves as a reminder of our rich history in protecting the places and people we know and love. The beautiful landscapes from the pristine lakes and rivers to the lush forests and prairies that define our home. It is a day to reflect on our responsibility to care for our communities and the ecosystems that support us, to ensure that every Wisconsin family can thrive for generations to come. Today, we are here to introduce Wisconsin Climate and Health Action Together, or CHAT. CHAT was created by over 70 partners from various sectors, including public health and climate organizations, healthcare providers, tribal communities, universities, nonprofits, community-based organizations, and local, state, and federal government agencies. Together, we are united by a common goal: to improve health outcomes for all Wisconsinites in the face of climate change, which is already threatening our well-being. As we know, climate change poses significant risks to our physical, mental, and cultural health, from increasing breathing issues from poor air quality to damages to homes or spiritual places during flooding. Chat is committed to tackling these challenges head on by talking about them, then fostering community engagement and promoting community level solutions that empower individuals and organizations to take meaningful steps toward a healthier future. You may be thinking, why are we starting with simply talking about these issues today and sharing stories? Well, because studies from Yale, other universities, and public polls all agree and continually show that the majority of Wisconsinites are worried about climate change, and even a higher majority agree that we should pursue practical solutions. But when asked about whether people in their town or community care about climate change, people heavily underestimate the support of their neighbors and friends, and we can't get anywhere if we think we are alone. Part of the challenge is that only 34% of Wisconsinites say they discuss climate change with others, and even fewer said they heard about it in the media at least once a week. So today we are taking a step to change that by sharing stories of how people from across Wisconsin have already been impacted, and some solutions and actions that Wisconsinites are already taking and calling for. So I will now introduce our first speaker, Dr. John Moyer, a Milwaukee pediatrician and professor of pediatrics and community health at the Medical College of Wisconsin. Go ahead, John.
Thanks, Abby. I'd like to share my climate and health story in hopes of inspiring more Wisconsinites to take meaningful steps towards a healthier, more sustainable future for ourselves, for our children, and for generations to come. As a pediatrician and father, I've seen the health impacts of climate change unfold not only in global reports, but right here at home. During my training in Houston, I endured hurricanes and their aftermath. In the Milwaukee area, where I live and work, I've witnessed heat waves, flooding, and the growing threat of wildfire smoke clouding our skies and our lungs. The science is clear and urgent. Human activity, especially burning fossil fuels, deforestation, and pollution, is driving the climate crisis. This isn't just an environmental issue, it's a public health emergency. Over 200 medical journals agree climate change is the greatest threat of our time. The World Economic Forum warns that extreme weather, biodiversity loss, and ecosystem collapse are top global risks in the coming decade. But this isn't just abstract data. Last summer, the temperature in Milwaukee reached 94 degrees, tied for the highest ever recorded on that June date. That afternoon, as a pediatrician, I cared for a 3-year-old girl in a summer dress who had been playing outside. She appeared flushed and weak, struggling to breathe with a fever of 104 degrees. She had no signs of infection. Her parents were terrified, and I was concerned she was suffering from heat stroke, a life-threatening emergency. Our pediatric team rapidly cooled her with sponges and fanning, gave her Pedialyte sips, and transferred her by ambulance from our clinic to the Children's Hospital for IV fluids, a cooling blanket, and admission. Fortunately, she recovered, but her case was a stark reminder that extreme heat, now the leading cause of weather-related deaths, is no longer a distant danger. It's already affecting the most vulnerable members of our community. The bottom line is that climate change hurts our health. Air pollution worsens asthma, heart and lung diseases. Shifting ecosystems are bringing infectious diseases to new areas. Food insecurity and forced migration are becoming real threats, fueling stress and anxiety, especially for our most vulnerable neighbors. That's why I've made climate action personal. We often eat plant-based meals, compost and garden with native plants. We are privileged to have solar panels on our home and drive an electric car. I advocate for affordable, efficient, clean energy for every home in Wisconsin. Professionally, I helped establish the Center for Sustainability, Health, and Environment at the Medical College of Wisconsin, where I teach future health leaders how to respond to climate challenges with care and courage. I proudly advocate with Healthy Climate Wisconsin, a growing network of healthcare professionals pushing for clean energy and environmental justice. Wisconsin is our home. We are known for our resilience, our communities, and our deep connection to the land and water. Together, we can be a model for how climate action and public health go hand in hand. Please join us this Earth Day. Let's build a thriving, sustainable Wisconsin for all.
Thank you so much, John. It is now my pleasure to introduce Jennifer Gauthier, an enrolled member of the Menominee Nation and director of the Sustainable Development Institute at the College of the Menominee Nation.
Oso Maoniwea. Hello, everyone. So I wanted to share that climate change is an issue that is woven throughout the Institute's work and research on energy sovereignty, indigenous food sovereignty, and forestry and phenology. On our reservation, continued unpredictable weather events have impacted our infrastructure, and we're exploring alternative energy sources to adapt. Our food systems and gathering practices are changing because of higher temperatures and extreme precipitation, and the arrival of new plant relatives, commonly known as invasive species, are changing the landscape. And with that, there is a change in our cultural practices. So within the Menominee community, our hunters, gatherers, fishers, and all those who spend time in the forest are seeing the impacts of climate change firsthand. So we follow the Menominee moon calendar, which provides guidance and environmental cues on how we should be living with the seasons. And this has been radically shifting for some time. We have been observing a shift in practices and noticing that our moon calendar is less and less aligned with the long-term shifts in the weather that we've been observing. An example of that is Supamahquin Queso, or the sugaring moon, also known as April. And this is a time when we're harvesting and boiling down sap from sugar maple trees. We've seen a swing in when sugar season starts and ends, and with some seasons starting as early as February because of the warmer weather, and ending sooner because it's so warm that the sap stops running. The snowpack and fluctuating warm days and cold nights needed for sugar season aren't present as they once were. This is just one of the many cultural food practices that are changing. We can add to this the changing berry seasons, the shorter or non-existent milkweed seasons, wild rice unpredictability, and fluctuating and changing fish runs and unhealthy fish that we're catching as well. There's so much more that's changing within our food systems. While we have always adapted to change, many recognize that there are cultural practices that we are engaged with that will either drastically change or disappear altogether. So if we're disconnected from our Menominee food systems and our cultural practices, how does this impact our health? How does this impact how our families engage with each other? How does this change our seasonal stories that have been here since time immemorial? And how does this change our Menominee language? And these are some of the climate change issues that many tribal communities are facing. At the Sustainable Development Institute, it's important for us to educate and to prepare that next generation about these issues. So our students are learning about climate change through research and land-based learning by weaving our Menominee ways of knowing with Western science. They're engaging with their cultural practices and understanding their value. Our ancestors carried on these practices for over 10,000 years. They gave so much to assure that we have the lands that we live on today, and they passed on this Menominee way of life to us. So we have a responsibility to ensure that those ways continue for next generations in spite of climate change. And while they may be inheriting a different environment, I have hope that our young people will ensure our Menominee ways of knowing continue. And thank you.
Thank you so much, Jennifer. Our next speaker today will be Dr. Joan Schiller, a medical oncologist in South Central Wisconsin.
Good morning, everyone. I'm a medical oncologist who specializes in lung cancer. Lung cancer is the leading cause of cancer deaths in the United States, accounting for nearly 1/4 of all cancer deaths each year. Even with the many newer, more effective treatments that have recently become available, the 5-year survival rate of patients diagnosed with metastatic lung cancer is only 6%. Most people know that smoking a tobacco is the #1 risk factor for lung cancer, but many people are unaware of the environmental factors that also contribute to lung cancer, such as air pollution. Air pollution is a Class 1 carcinogen, as rated by the International Agency for Research on Cancer. A carcinogen is a term, as you know, for a substance that causes cancer. And the one cancer we know for certain that air pollution causes is lung cancer. It's responsible for about 14% of all lung cancer deaths worldwide, including in people who've never smoked. Air pollution contains very small particles, which are particularly dangerous, and that come from the burning of fossil fuels in factories, power plants, and motor vehicles, as well as wildfires, which we all know are becoming more frequent and intense as a result of our changing climate. There are a few stories that have remained with me throughout my career. I recall a young mother who never smoked, yet was diagnosed with non-small cell lung cancer at the age of 35. She was a physician, a mother of 2, and a long-distance runner, and she died of metastatic lung cancer about 2 years after her diagnosis. I remember another lung cancer patient, a 32-year-old emergency room nurse with no risk factors, raising 2 teenage daughters. She was divorced and desperately worried about what would happen to her daughters when she was gone. Both women were lucky, and I say that in air quotes, in that they survived long enough to see their children graduate high school. But they should have had decades left with their kids. Now, while we will never know why these 2 women developed lung cancer, we do know that the incidence of lung cancer in young women who never smoked is on the rise. Too many people are dying needlessly from this deadly disease caused by air pollution. We must do more to protect our air and prevent more needless deaths from lung cancer. Thank you.
Thank you, Joan. I will now introduce Michelle Danforth Anderson, Oneida Nation Marketing and Tourism Director.
Good morning. For anyone who doesn't know where the Oneida Nation is, we are actually located just outside of Green Bay. And our territory, the reservation boundaries are roughly 12 miles by 8 miles. And we have about 65,000 acres in that territory. However, we only own about 44% of the actual reservation. And I'm going to kind of go along the line of what Jennifer said from Menominee as far as the unpredictable weather. And so for us here in Oneida, we own about 9,000 agricultural acres, and we farm about a little over 5,000 acres. So the unpredictable weather, the excessive rainfall really has an impact on a lot of different areas. We farm a lot of crops, and sometimes those crops can be affected We've been restoring wetlands. So part of the what we do with the wetlands is we are also restoring wild rice beds. And so if we get excessive rains, it can wash out our rice beds. And that impacts what we can harvest in the beginning of August. The other big impact that we had, which was really, it was a very hard impact for us, was actually it happened last year. And because in 2023, the winter was so warm, we have about 4,000 apple trees in our current Oneida Nation orchard. And so with the warm weather, the trees actually blossomed earlier, and then it's been almost actually like a year. And the blossoms, there was a hard freeze, and we ended up losing about 85% of our crop, which not only impacted our business of the orchard and selling pick your own or apples to the local grocery stores, it also impacted programs for our food distribution. For community members, we do special pickings for elders and different things like that. So it was very hard to drive past the orchard and see the trees were kind of brown. It was incredibly sad, and we ended up doing a video at the end, and there was life at the top of the trees, so that made us very hopeful. And we're still kind of holding our breath right now because we don't, nothing has quite blossomed yet. So we're hoping, fingers crossed, that we will have a very bountiful harvest this year. And one of the most exciting projects that we have going on is that we've restored 6 wetlands within the reservation boundaries. And this is with different partners, whether it's local, state, federal partners. And the reason why it was so important is because that's exactly how the land used to be, and the importance of actually the wetlands and what they can do as far as, mitigating some of the flooding or cleaning the water. Those are the most important things. And so that gets to like, well, why am I the director of tourism? Why am I talking today? It's because we actually do eco tours, and we are, as part of the tours, and we have a very nice site called the Amelia Cornelius Culture Park, and we do a lot of educational tours. So it's important to roll in some of these traditional practices or traditional ways, and to keep teaching the kids about the environment, because unfortunately they are the caretakers of the future, and hopefully they can make big changes to help counter climate change. So we're just going to keep teaching everybody we possibly can. And yeah, that's kind of what's going on in Oneida right now.
Thank you so much, Michelle, for sharing your experience and story. As our last speaker today, we have Dr. Rachel Pierce, an assistant professor of nursing and a family nurse practitioner in Northwestern Wisconsin.
Hello, thank you for inviting me to speak here today on Earth Day of all days. Living in Western Wisconsin, I'm privileged to beautiful landscapes. These include bluffs, rivers, lakes, forests, and prairies. And the climate here has traditionally been warm in those precious summer months and bitter cold during the long winters. But in recent decades, there's been a shift in the climate. We're getting more rain, we're getting hotter summers, we're also getting warmer winters by almost 5 degrees Fahrenheit. I've worked as a healthcare professional for the past 16 years. I witnessed firsthand the health impacts of climate change, especially on those most vulnerable, such as children, older adults, low-income, and unhoused populations. I'd like to share a patient story with you that highlights how climate change and health are intricately connected. In February, parents brought their previously healthy 4-year-old daughter into urgent care. The parents were distraught. Their daughter had been extremely ill for the past month. She had unrelenting fevers, chills, fatigue, headaches, and recently began limping. Upon assessment, I noticed that her left knee was swollen, warm, and painful. After a workup that included blood labs and X-ray imaging, a diagnosis was confirmed. The culprit was something no larger than a poppy seed. She was infected by the bacterium Borrelia burgdorferi and had likely been bitten by a deer tick. This infection is commonly known as Lyme disease. Lyme disease is a bacterial illness that can cause skin rashes, fevers, headaches, fatigue, joint pain, numbness and tingling, and heart issues. It's the most common vector-borne illness in the United States. Vector-borne means that it's a disease transmitted by mosquitoes, fleas, or ticks. So you might be thinking, didn't the parents realize that she had been bitten by a tick? Well, deer ticks measure only about 1 to 3 millimeters. It's very common for people not to realize that they had been bitten because deer ticks are so small, and only up to about 80% of people develop a potential rash after being bit. What's important to note is that about 50% of deer ticks in the Midwest carry Lyme disease. Studies show that climate change has contributed to increased Lyme disease infections. The life cycle and prevalence of deer ticks are strongly influenced by temperatures. Deer ticks are most active when temperatures are above 45 degrees Fahrenheit. Warmer temperatures have increased the range of tick habitats. Warmer temperatures also mean that there's no longer a tick season in the Midwest. Local veterinarians now recommend that dogs and outdoor cats receive year-round tick and flea prevention medication. Because of climate change, humans and animals in expanding regions and for longer periods of time are exposed to Lyme disease. So why is this patient story important? Well, as was already discussed, tick-borne illness rates are increasing in our area. People who become infected will not have a positive blood test until approximately 2 and possibly up to 6 weeks after they were bitten. Tick-borne illnesses are very expensive to diagnose. A tick-borne disease panel through blood testing can range from $1,500 to $2,700 and generally is not covered by insurance. Even after antibiotic treatment, tick-borne diseases can cause lifelong symptoms such as fatigue, muscle and joint aches, weakness, headaches, memory issues, heart palpitations, irregular heartbeats, and heart block. These effects can absolutely be devastating, but the heart issues can sometimes be fatal. Our call to action. It is all of our responsibility to fight climate change. According to the United Nations, emissions from the burning of coal, oil, natural gas, industrial processes, and transportation are mostly responsible for the warming of our planet. Implementing clean air initiatives is an important place for us to start. Thank you all and happy Earth Day to our beautiful planet.
Thank you everyone for being here today. We are now going to invite any press in the room to ask questions. You can use the Q&A the Q&A function or raise your hand and we will take you off mute so that you can ask. 1 second here.